I've been involved with talking to politicians and trying to raise the priority of musculoskeletal health and low back pain for quite a few years now. And to begin with, I've learned two lessons. First of all, that health policy is about priorities. Musculoskeletal health has not been prioritized so far. And the other lesson I've learned is that politics works, because if you set your priorities, you achieve goals. And the main indicator for the health services has been life expectancy in Europe for a long time. And we have succeeded there. Cancer survival rates are, on the rise, and we are preventing heart disease by banning smoking and having much better treatment. So we live longer, but that carries along more disability. That's the challenge. And as we're getting older and more disabled, who's going to pay the bill in the future? This is about sustainability as well of our societies. So I think we have to resaddle and think about how do we get health services that gives us more healthy and productive life years, not only focus on life expectancy. So musculoskeletal health has remained the elephant in the room for a long time now. And in particular, low back pain, as Professor Hartvigsen has just addressed in his talk. And why doesn't low back pain receive any attention? Of course, as I just said, low mortality means per se low priority in politics. And low back pain has also got low status in medicine, because medicine has had very little to offer for low back pain. And a lot of what's been done doesn't work, doesn't have effect. And there's been little political awareness about the real costs and burdens of all the disability that low back pain carries. It is the major cause of disability in the Western world. And finally, the experts, there's been a lot of controversy. Is low back pain a real disease, or is it just laziness among the workers? And when the experts disagree, it's very difficult for politicians to take actions. So there's been a lot of confusion in this area. And as we've just had seen by the Lancet papers, that this is a revolution now. Now we know what to deal with. Everyone does. So we have to face the hard and indisputable facts. And the situation in Norway is the same as in all other Western countries. Low back pain is the #1 cause of disability. Neck pain is number 3. And chiropractors, by the way, are spinal experts and dealing with these problems. So it's no coincidence that me, as a chiropractor and leader of a chiropractic association, have advocated the importance of low back pain and the impact of low back pain to members of our Norwegian Parliament through many years now. If you look at this slide, you also see that the communicable diseases, infections, malnutrition, etc., it's not there. It's not a problem anymore, or it's not a big problem anymore in the Western world. It's all about the non-communicable diseases. And as Jan Hartvigsen also just told us, although the health service are now focusing on the NCDs, musculoskeletal health is not mentioned. It's not in there yet. So we got a big challenge. What does this mean in Norway in numbers? It means that musculoskeletal conditions accounts for 1/4 of all years lived with disability. And it accounts for 40% of the sick notes and 1/3 of the disability pensions. And low back pain and neck pain is 80%, almost 80% of all the disability from musculoskeletal problems. So the spine is the big one. In Norway, almost 800,000 people suffer every year from low back pain and 450,000 from neck pain. This gives us 10 million workdays lost yearly. And the total cost in Norway, estimated by our Directorate of Health, is 18.5 billion euros in 2015. So we got a huge problem. And this is the story that I'm telling our members of Parliament in Norway. And I would like to show you this quote from the Norwegian Parliament in 2015, because in Norway, our members of Parliament has lent their ears to us through quite a long period now. So Mrs. Marianne Aasen, back then the chair of the Education Committee, she said in our Parliament, I would make a claim that Norway is now ready to be a world-leading nation in the musculoskeletal field. I justify my claim based on a unique position Norway is presently experiencing. Why is it so? And she continues, it is because we have plenty of chiropractors in our country, and their services are highly accessible and much utilized by the population. Their services account for a greater proportion of the total health service than in most other countries. End of quote. I think this should be very interesting to the European Union, and what have brought Norway into this special situation, made us a special case, together with Denmark, I would say, that are almost in parallel with our development and ahead of us in other aspects. Well, Norway is a small country. We are a little bit more than 5 million countries. So you see all the blue countries on the slide. They are the less populated countries in Europe. But we are the most populated country by chiropractors. We have the highest density of chiropractors per capita in Norway, and we've had a more than 100% increase of chiropractors for the last 10 years. Furthermore, chiropractic has been the fastest growing health profession in Norway for many years now. And utilization, the number of reimbursed consultations increased by 7.9% from 2016 to 2017. It's a popular service. This means that 350,000 Norwegians, individuals, was treated by a chiropractor last year, with more than 2 million consultations. And virtually 100% of the chiropractors' diagnoses are musculoskeletal problems. And 80% of this, again, is low back pain and neck pain. So we are matching this challenging picture that we've just shown you. So what has brought us there? Well, it's been a combination of a very high and dedicated professional drive fronted by our association. It's been a result of high ethical practice, high standards by our members for many years. But not the least, it's a consequence of political actions. And I would like to point to two very important events. First of all, chiropractors were authorized 30 years ago in 1989. That was the difficult one. 30 years ago, and since then there's been a tenfold of chiropractors in Norway. I think that's a message also to every European country that you need to start with legislation. But it went on in Norway. Chiropractic was growing. It was popular service among the population. The politicians started in dialogue with our association to look at ways of improve the utilization of our services. And the result of this was that in 2006 we were given extended rights, which really gives us a role quite similar to the GP in the health system for the musculoskeletal patients. We got rights to refer to hospitals, to medical specialists, and to diagnostic imaging. And at the same time, reimbursement was no longer dependent on medical referral. All patients were reimbursed. So through political decisions, Norway has secured patient safety, accessibility, and good utilization of chiropractic within the health system. So that makes us a special case. This was confirmed by a survey among the population 2 years ago that shows that now physiotherapists, chiropractors, and general practitioners are considered equally qualified or preferred for a musculoskeletal problem. I think we should dwell then that this is also the 3 health professions that are preferred by more than 3/4 of the population. I mean, the rest, alternative medicine, etc., is just a small fraction. The large bulk is authorized health personnel, and that all these 3 groups have reimbursements, and that gives also the authorization and regulation by law also gives, from a governing point of view, gives the politicians a possibility of allocating resources where they are needed in the health services ahead. And we've just shown you that we have to focus on low back pain soon. We're almost done. This is another quote from our Minister of Health, Bent Høie, that 2 years ago decided that there should be no limitation of number of treatments reimbursed in Norway. And he justified this by saying that chiropractic treatment is important in the rehabilitation of patients with musculoskeletal problems. And some patients are in need of more treatments to maintain function and stay active. I.e., our Minister of Health in Norway is saying that chiropractic is important in order to maintain function and stay active. That's addressing disability. That's giving more active, productive life years. And we should also note that the government puts a great deal of trust in the chiropractic profession by removing a limitation. Reimbursement is unlimited for number of treatments. Still, the average number of treatments per patient in Norway treated by chiropractor is a little bit more than 5. So it's no problem. This is a possibility for patients that require a lot of treatment to maintain function and stay active to get it. And lastly, we've worked for a long time to establish a university program in Norway to educate our own chiropractors. This was said in our parliament just before Christmas with the fiscal budget that musculoskeletal disorders are the main cause of sick leave and social isolation and challenge the welfare state's sustainability. And therefore, we need to establish education, develop research, as we just heard, and will benefit a growing patient group. So, in conclusion, making the elephant visible in the room has led to changes in Norway. And as I've shown you, chiropractic is now widely accepted and highly utilized by the population. And I think this development might lead the way by example for the rest of Europe. Thank you.